Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have Sierra Drevline with us once again. She is the Director of Employee Health Services for Masonicare. Welcome back, Sierra. Thanks for joining us.
Thank you.
Dr. Schwartz, let's begin with the latest COVID-19 news, and that, of course, is the discovery of a new variant named Omicron. Initial reports about its characteristics are a bit troubling. Can you fill us in on what you're hearing?
Well, I can, Sandy. And once again, there's a new word for the week for COVID, Omicron. I'm going to spell it for you in case you haven't heard it before. I think most people have, but it's Omicron, Omicron. You're going to hear a lot about that name going forward. So now I'm up to having two articles to present. Almost every time we do the show. It used to be one, now there's two. But again, I'll try to be brief and give you just the salient points to get you up to date with current thinking. So the first article is prior coronavirus infections may not protect well against Omicron. So I'm going to read some of the findings here. And they say new data from South Africa suggests the Omicron variant spreads more than twice as quickly as the Delta variant, and that immunity from prior infection doesn't appear to protect a person very well against Omicron variant. Then they say why it matters. The findings are extremely preliminary, and there are still many open questions about how well vaccines work against the variant. But these initial breadcrumbs of data are helping the world begin to understand what it's up against. Where it stands, they say. It's going to be a while before we can draw any firm conclusions about Omicron. Until then, scientists will be racing to piece together whatever information they have, and policymakers will then have to make real-time decisions about how to apply that imperfect information. Then they have a title, Driving the News, a South African preprint study released last Thursday, which hasn't yet been peer-reviewed, found that reinfection is around 3 times more likely with Omicron than it was with other variants. The study makes no assessment of whether Omicron can also escape vaccine-induced immunity, or how well prior infections protect against severe disease. Then they say South African researchers also released an initial assessment, which also had not yet been peer-reviewed, of how fast Omicron is spreading compared to Delta. The variant's ability to get past the body's immune system is part of what's driving the variant's speed. So finally, in conclusion, they say experts caution that it's way too early to know for sure, but there are some signs that Omicron may not cause more severe disease than the other variants. Under the best case scenario, it causes milder illness. So what's the bottom line? This is a take-home message and the bottom line. This early information underscores the importance of getting vaccinated, even if you've already had COVID. So that's probably the take-home message from that article. I'm going to talk about one other article, and again, I'll make it brief, but this article is entitled First Omicron COVID-19 Case Detected in Connecticut. So this says, according to the Connecticut State Public Health Laboratory, a man in his 60s from Hartford County developed symptoms on November 27th and tested positive for COVID-19 on November 29th. A molecular test was also positive on December 1st, while a family member who traveled to New York City for the ANEMI New York City 2021 convention had tested positive as well. Their symptoms have resolved, and additional family members waiting on their COVID-19 testing results, at least at that time. The individual as well as their family member are both fully vaccinated, officials say. So this is a quote now from Governor Lamont, and he stated, and this is his quote, while we are still learning more about this variant, our health providers are continuing to do their best to protect everyone. We have life-saving tools like vaccines and boosters available to fight this pandemic, including the Delta and Omicron variants, and I urge everyone to take the necessary precautions to protect themselves and everyone around them. And this is a quote from the Connecticut Public Health Commissioner, Dr. Manisha Yuthani, who also noted that it was only a matter of time before the variant was found in Connecticut. And a quote from Dr. Yuthani says, although Omicron appears to be more infectious than the Delta variant, both affected individuals have had mild symptoms to date. It is reassuring as their immunity seems to be helping them fight off this infection. Vaccination and boosters are still our greatest defense. If we can keep people out of the hospital, reducing morbidity and mortality of COVID-19, it is still a win for vaccines in our society. So you see, I think the conclusions of both of these articles is it's still crucial to get vaccinated, get boosters, continue to practice good health control practices. So now that you've been patient and listened to my article presentation, I'll give you my inspirational quote for this week. And it says, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. And that was actually said by Martin Luther King Jr. And I think it's a great quote, and it shows us that whatever we do, we just have to keep moving forward, to keep being diligent, doing what we're doing, working together, getting vaccinated, getting booster shots. And I thank everybody for all their hard work and cooperation. And as I always say, health and peace. Thank you.
Thank you, Dr. Schwartz. We always appreciate when you break down the information for us throughout this whole process. And Sierra, here at Masonicare, COVID-19 booster shot clinics have been continuing. Can you tell us how the process is going? And have you seen an increase in the interest for boosters since Omicron has been detected in our state?
Hey, Sandy. As you may recall, the boosters have been available since the end of September. So we've had a lot of clinics throughout our organization hosted by Big Y and Nutmeg Clinics. And we've had a lot of interest since the beginning because we were over that threshold of 6 months since our original clinics last year. So I think a lot of interest has been continuing through these winter months as we see more respiratory illnesses. We continue to have clinics through the next 2 months because we announced the mandatory booster dose on Monday, the 6th. And that was really important because the CDC had determined and updated their booster guidance and their interim clinical considerations on their site to say that anyone 18 years and older should receive a booster. So it's really important that we follow those recommendations because the CDC monitors what's happening in the community. They're monitoring large population groups, and they're noting efficacy and the waning efficacy of the original vaccine series based on when it was given. So I think it's really important as healthcare workers. I think it's really important as people who want to maintain normalcy in our personal lives to continue to get the boosters. So I would say that not particularly there's greater interest. I will say that I think there's always been interest in the booster. Thank you.
Great, Sarah, and we thank you for your continued efforts. And finally, JP, it's hard to believe, but we are just a few weeks away from Christmas. As folks plan their holiday get-togethers, we want to encourage them to exercise good safety practices to avoid a trend that we've unfortunately seen several times during this pandemic.
Sandy, thank you. When we look at the holidays, I think we're looking at the holidays differently than we probably have in years past. Last year was a very challenging time, I think, for all of us. I will say that I'm happy to report to some extent that we are seeing less cases than we did last year in the same time frame after the Thanksgiving holiday. So that's good news. That's telling us that people are being vigilant and the vaccines are working. So I will say that as we move forward with the holidays this month, we still need to be very vigilant. Still need to make sure that we are good hygiene, wearing our masks when we need to, because ultimately all of that is going to help reduce the spread of the coronavirus. And though there's a new variant, there's a lot of good news coming out. Today, Pfizer made some very promising announcements with regards to the new variant. So I think we're going to continue to battle this in so many different ways. I do want to thank all of our staff for all that they are doing. I know that we are well into almost 2 years that we have been battling this. We are very close to the 2-year mark, and our staff have done a truly amazing job combating this. Sierra, Dr. Schwartz, Sandy, and all of our staff have really done a truly amazing job. And I want to thank you. And in this time of a holiday spirit, let's give thanks to our residents who have also endured so much during this crisis, and their resiliency. You know, being able to go and see our residents more regularly has been, I think, a good boost to, I think, the morale of our residents and staff, and we're going to continue to do that. But as we move forward, we still need to be vigilant. We still need to know that this virus is still out there, and the holidays moving forward, we are expecting to see some bumps in cases, but we're hoping that those bumps are not nearly what they were last year. So to end, let's be vigilant. Let's make sure that we're wearing our masks, doing our social distancing as much as we can. But the booster is there to help us. So let's do it as really the ability to make us, I think, a better community, better organization, and better state and country to really combat this virus. So I would leave you with, as Dr. Schwartz said, we need to continue to move forward, continue to push, and that is really where I think we're going to see ourselves as a society, as an organization to combat this terrible virus.
Absolutely, JP. Thank you so much. We are all in this together, as we have said from the beginning. Well, I want to thank you all very much for sharing your time and your insights with us today, as always. And thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.